One, we have also been indicating to the public that the daily rate of increase of cases globally is in the vicinity of 140,000 per day. When last we were here on Saturday, it was 7.8 million. And we did say then, don't be surprised when we come on Monday morning, we touch 8 million. What is the case? What is the global caseload today? 8,028,325. So as predicted, the world has reached the 8 millionth milestone. Of those, 436,277 persons, souls, people have in fact died. 54,538 persons around the world are in serious or critical condition. Serious or critical. That means they are most likely in a intensive care unit setting, a high dependency care unit setting, probably on ventilators. And we are still in the midst of a global pandemic affecting 213 countries. I think this morning these figures will resonate with the population in a way that they have not resonated for the past month and a half because of what transpired over the weekend, and we will discuss that. To lend further support to the argument that we are in the midst of a global pandemic, when we first started giving the statistic of the global caseload per million about 2 months ago, I distinctly remember the figure then was 104 cases per million population. Do you know what it is today? 1,030. It has increased in the interim by a factor of 10 times. That is a serious increase in cases. As Trinidad and Tobago enters a different phase, and I just touched my face, as Trinidad and Tobago enters a different phase as we start to allow the managed return of our nationals, it is important for the country and all of us in health, all of us who are responding to this, that we need to manage our resources moving forward because we don't know how long this is going to last. We have no idea. This is new to the world. It is new to Trinidad and Tobago. It is new to the Caribbean. As your Minister of Health, it is my responsibility to manage the HR resources, the physical resources, the medical resources, and we all as a society must keep mentally strong at this point in time as we enter a new phase, even though there is no immediate risk to society because we have isolated these 6 cases over the weekend. We must all stick to the plan as articulated by the Honorable Prime Minister from day one, with the simple objective, saving lives. That is what we are about, saving lives. And the final point I would like to make as we continue this robust, well thought out reintroduction of our nationals is that you will have noticed that from the very day we took the decision led by the Honorable Prime Minister after he consulted with the Ministry of Health, Minister of National Security, it must not be lost on the population that we have not had to reverse one decision to reopen the economy. Many countries are not in that fortunate position. Because we have been measured, because we have listened to the science, because we have looked at data, and we didn't give in to populism, the gains that we are making now in reopening the society more and more, in encouraging more and more economic activity, we have not had to roll back any of that. That's a phenomenal achievement for a small country like us. So we need to keep these gains going. We don't want a reversal of that. And so far, as a society, business, labor, the general public, we have done brilliantly, we have done well. And we need to congratulate ourselves. There are still some individuals, as you would expect, who are still not getting a message to wear masks and so on. But you expect that. But the gains we have made in reopening the economy and by actually speeding up the phases, including places of religion, must not go unnoticed. And as we manage this new phase of our part of this global pandemic, let us continue as a society to jealously guard those gains so we don't reverse it, so we don't have to re-lock down and stop economic activity, so that we all can have a job. We all can participate in an open society as we move forward. So, Minister Cox, those are my global analysis this morning, and those are my messages to the country this morning, and I thank you for this opportunity.
Thank you. Thank you very much, Minister. The Chief Medical Officer, Dr. Roshan Parasram, will provide us with a clinical update. Dr. Parasram.
Hi. Thank you, Minister Cox. Good morning, honorable ministers, members of the media, members of the viewing and listening public. The clinical update for today, the 15th of June 2020, is as follows. Number of samples submitted to the Caribbean Public Health Agency and University of the West Indies site, 4,001. Number of repeated tests thus far, 511. Number of unique patient tests completed, 3,387. Number of positives, 123. Number of pending samples. So there are pending samples today of 103. That is spread between the UE Jamaican contingent that came in on Saturday, late Saturday, as well as 3 persons from the Venezuelan group. And those results should be between today and tomorrow. We'll have those results for you. Community samples now go up to 1,605 Tobago, of which 179 come from Tobago. In terms of our facilities in the parallel system, we now have 503 persons within the parallel system. So at the UE St. Augustine Day Bay Penal campus, there are 11 persons. In the Cascadia Hotel, there are 2 persons. Chancellor Hotel, 14 individuals. The Tacarigua facility, there are 29 persons. At the Napa facility, we are housing 12 healthcare workers. The Home of Football has 8 individuals. At the Sandy Grande Brooklyn Center, there are 24 persons. And still on the Enchantment of the Sea, on the vessel docked outside the port of Port of Spain, there are 300 individuals. As you would recall, 6 of those persons tested positive from that cruise ship and were taken to the Cora Hospital for treatment. At the UE Canada Hall, there are 100 students being housed there presently. Minister Cox, that's my summary for this morning.
Thank you very much, Dr. Parasram. Members of the media, the floor is now open. Remember to identify yourself and the media house you represent before posing your question. And we want to give as many of you an opportunity to pose questions to us, but that means in our limited time, we will have to give each media house a chance to get a maximum of 2 questions in. And once we have completed the pool and time allows, I will come back to you. Let us keep this in mind as we begin taking your questions. Newsday.
Hi, good morning all. Shane Super from the Newsday newspaper here. Are you hearing me?
Yes,
Good
Shane.
morning.
Morning.
Yes.
Hello?
Yes, we are hearing you.
Yeah, I'm losing volume in and out. I have 2 really quick questions. The first one could be answered either by the minister or Dr. Parasram. It has to do with, well, I know Dr. Parasram would have given us a brief outlook of the condition of the 6 patients from the Enchantment of the Seas cruise, but can he give us a more detailed idea of what the conditions are like aboard the cruise ship in terms of the rest of the passengers who are quarantined? So that's the first question. The second question, well, we are in the midst of the rainy season right now, and I know that around this time of year we just see a lot of illnesses like influenza and so on. I just wanted to know, in light of this, Are there adequate facilities? Are there adequate resources in place to cope with what may or may not be an increased burden on the healthcare system as we know it?
Okay, Shane, let me just make a little correction as you move forward because this is important. At this time of the year, influenza actually goes down, not goes up. Our flu season runs from October of any one year to May of the following year. So we are actually coming out of our flu season. So I want the public to understand that the assertion that because of rain flu goes up is actually not entirely correct. So I'll hand over to the CMO now.
So in terms of the conditions about the ship, so the ship is being used as a quarantine vessel. There are 300 persons on board. All of them would have been examined when their nasopharyngeal swab was taken when they first came in on Friday afternoon. The symptomatology I have gotten is no one had any major symptoms at that point in time. Actually, most of them were asymptomatic out of the remaining 300. So the swabs were taken. We would have gotten the results between Saturday. We did half of those on Saturday, the remaining on Sunday, and we would have gotten those results, one person being positive on the Saturday and the remaining 5 on Sunday. So that encompasses the 6 persons. So it is a rigid quarantine setup where persons will remain within their cabins and food will be brought to them in their cabins. There should be no mingling occurring on the vessel at this point in time. So, I mean, we can go further into it as we go, but basically it is being treated as a quarantine vessel. We will watch and see if people develop symptoms. So there's daily logs in terms of histories. So they will ask everyone every day to check their temperatures and basically look to see if they develop any symptoms. If, of course, there's any temperatures that develop or any symptomatology, we will re-swab those individuals. And then, of course, based on the result we make some decisions.
Let me just go back to Shane's first question because I don't want to leave that question about rainy season and flu hanging. The Chief Medical Officer will have brought his charts and graphs here last week, and he indicated clearly because of the public health measures that we instituted due to COVID, the incidence of all acute viral illnesses, which include influenza and gastroenteritis, have gone down significantly. I also answered that urgent question in the Parliament on Friday, and the incidence of acute viral illness for the year, where it is normally hovering around 1,000 to 1,500, CMO, correct me if I'm wrong, is now down to 150 thereabouts. It's about 15%. So I just want to let the population know the incidence of influenza is significantly less now. Okay? Thank you.
Thank you. 98.1.
Good morning to ministers and good morning to the CMO. Stephen Cummings, 98.1 FM. My 2 questions quickly. First to Mr. Dayal Singh. Minister, just some clarity with what I've been reading about $45 million being spent on public health in response of COVID. There is a report which quoted you as being shocked over the high costs of treating one COVID patient with the use of a drug or drugs costing to the tune of $100,000 to $200,000 per patient. Are those costs correct, or can you clarify
those costs
further?
Are absolutely correct.
Hold on.
Another question, which
question,
can either go to the Minister again or Dr. Parasuram, with reference to the coming in or the taking in of additional persons, nationals into the country. I know that before there was a list of countries that were drawn up from which caution was being exercised. Has there been any updated list of those countries from which we may need to exercise continued caution? Thank you.
Okay, so thank you very much for the question. So I'll go first. Yes, sir, those costs are actually quite correct. And that's why in my opening statement, Mr. Cummins, I said clearly, as we move forward in this new phase, it is my responsibility to manage resources, whether it be physical resources, HR, medical, financial. because this next phase, as we allow more and more people to come in, we don't know how long it will last. We don't know how many people we have to treat. And that's why I was at pains in my opening statement to say that as your Minister of Health, it is my responsibility to manage resources. Just by way of comparison, one of my colleagues over the weekend WhatsApp, and I confirm that this is true, WhatsApp me an article from a country, I wouldn't call the country, that a coronavirus patient got a bill. Because remember, in other countries, if you don't have money, you die. If you don't have insurance, you don't get coverage. That person actually got a bill for $1.1 million US for their coronavirus treatment. We provide all that in Trinidad and Tobago from the taxpayer, absolutely free of charge. So yes, I was shocked when I got the cost of that one drug, $100,000 to $200,000 TT dollars per person. Thank you, Mr. Cummins.
Dr. Pasram?
Right. So in terms of your additional countries, so basically the borders are closed to all countries at this point in time. When things change in the coming months, I assume there will be countries that would have decreased transmission or no transmission at all. We will have to look at possibly a reverse order in the way we allow people into the country. So, for instance, when we look at countries like the United States, which a lot of people come back into nationals, we have their figure for the last 24 hours are 22,133 people would have been tested positive within the last day in the United States. I believe that's the highest total they would have had for quite a while, if not the highest total they would have had. So their numbers are still rising. Similarly, in Brazil, we have 25,982 cases within the last 24 hours, which is reported by WHO. So their numbers are rising as well, and they're all around us. So we have to judge basically if and when to reopen our borders based on what the circumstance is on the outside, just as we closed it based on what the circumstance was at that time in certain countries. But for now, because the pandemic has spread so quickly throughout the world, the situation in no particular country has reached a stage that we can allow entry from any one territory as yet. So hence the reason we had made the recommendation to continue to have the borders remain closed.
Thank you. ACP News.
Hi, good morning. Prior Harry, ACPnews.com. Minister and CEO, I want to take you to the press releases you all issued yesterday. The first one is update number 274. In that, you stated that there were 308 tests that were submitted to CAFA. There were 153 completed and 155 pending. And on that release, you stated that all other cruise ship passengers remain quarantined. And in the second release you all issued yesterday, that is update 275, you stated that all other cruise ship crew members remain quarantined. So I just wanted to find out, are these people the 6 people who are now who have been testing positive, are they Trinidad and Tobago nationals, and are they crew members aboard the cruise ship, or are they passengers?
Right, so the persons aboard the cruise ship, if you remember right, they were crew members, and we had received some notification from the agency asking us to be specific with that fact. They didn't want it to be seen as passengers in terms of public relation. So if you recall, those individuals, they are nationals, but they were crew members aboard various cruise ships, and they were consolidated into one ship. So they are nationals and they are crew members as well.
Okay, thank you. TTT?
Good morning. My question is either for the CMO or the Minister of Health, and I'm just trying to find out whether or not there's been any further advice for the Ministry of Education regarding the wearing of face masks by SEA candidates. When the minister was here last, he indicated that children would wear masks on entering the school compound, but he said he still needed to have discussions with the Ministry of Health for further advice on whether or not the children would be required to wear it during the exam. So I'm just trying to find out whether or not there's been any final decision with that.
So in my multi-sectoral committee, there's a representative from the Ministry of Education. Myself and the permanent secretary from Ministry of Health would have met with the PS of Education and their technical officers about 2 weeks ago to have an initial discussion. Tomorrow we will finalize that discussion. We would have provided them with a UNICEF WHO document guiding schools in general, which speaks to age-appropriate public health measures, does not speak to mask in that particular document. However, when we conclude our discussions tomorrow, the topic of mask is going to be discussed. We want to focus mainly on 3 things: sanitizing surfaces very regularly, ensuring that hand washing and hand sanitizing occurs, and the most important one is to ensure that if teachers or children are ill, that they stay away from the compound. And those are the 3 elements that we will be focusing on. Masks are on the fringes to some extent, may need to be worn by invigilators who go between students, and they would be adults, so they'll be going from one place to the next, therefore not being able to social distance during the examinations. So that might be a possibility, but I don't want to preempt the discussions tomorrow.
Thank you. TV6.
Morning, everybody. Rishi from TV6. My question is for the Chief Medical Officer. Dr. Parson, given your initial reservation about the cruise ship environment, is there any, and I mean we're talking about lives here, right? 300 lives, 300 people on that cruise ship. Is there any concern as to whether cruise ships with their central air conditioning, etc., are suitable for quarantine? That's my first question. My second question: what are the effects of any lack of action now?
Effects of what?
What is your second question, please? Repeat your second question. Repeat your second question.
Oh. Are you hearing me?
I want you to repeat your second question, please.
So my second question is, what are the effects of any lack of action now with respect to those 300 people on the cruise ship?
Thank you.
Action.
Okay, we take the first one.
Okay.
In terms of the first question, we're speaking about a cruise ship that was dedicated for the purpose of quarantine. So it would have been not used for any passengers for quite a long period of time. All the persons would have been put on board, so it would have been somewhat decontaminated prior to bringing persons on board. Hence the reason we would have done the initial tests and gotten those individuals who were positive off quickly. So ships have extremely large capacities. So in the thousands, we're looking at 300 people spaced over a cruise ship with a very large capacity. They are put into different areas, spatially quite wide apart, and they are being monitored in terms of different zones. So there are green zones, yellow zones, based on the ships that they would have come from, and their predetermined risk based on their history. So I think given the fact that we would have got a fairly low number, 6 out of 306 of positives, we will continue to monitor over the next few days to determine basically if we get any persons with symptoms, and as things evolve, we will continue to make decisions on a continuous basis to see if we need to get any more individuals off. But I think the capacity of the ship is great enough, and the fact that it has been vacated for a long period of time gives us the assurance that the viral particles would not have contaminated the surfaces prior to those individuals going on board.
Let me just come in here again. You may remember on Saturday I mentioned that I insisted on getting a schematic of the ship. This basically, you may not be able to see it. This is each deck of the ship. So we have a schematic of each deck of the ship, right? And where people are housed and how they are spaced. So we did say on Saturday, no one will be in consecutive rooms. We will try to physically space them along each deck of the ship, right? So we have that. And we also have a spreadsheet here of every single passenger. We know their names. We know their cabin numbers. We know when they signed on. We know their date of birth. So it's a very big logistical challenge. But I think so far we have it under control as to using the cruise ship as a quarantine facility.
Minister, there was something about lack of action. There was some question.
Yes, some question about lack of action, but I don't understand what the question meant.
Overshi, could you clarify that your question, please?
Not here.
We're not hearing you. Could you clarify?
So just to point out, though, I know you all spoke about the arrangements, but I'm seeing a picture here that these people look like they are in cabins side by side.
Well, they ought
I don't know
not.
if you can clarify
So
that,
I want to
but
thank
I
you
was
for.
asking,
Yeah.
any lack of action now with respect to the quarantining of these 300 individuals?
Yeah.
What is the potential for spread?
So we want to thank you for that, and we will look into it. Those balconies are in fact separated, so we have to make sure, but I want to thank you for raising that. But we insisted that passengers not be placed in consecutive rooms because the cruise ship is big enough to separate 300 persons.
Thank you. Guardian Media Limited.
Hi, good morning. Good morning.
Good morning.
Just a couple questions. I just wanted to cycle back to the, I believe the CMO mentioned that there were 103 pending cases, and I just wanted to know, with regard to some previous statements made by the Minister of Health concerning the amount of spaces that we have in our parallel health system, in case of a worst case scenario, those 103 cases, will our parallel health system be able to handle such a large number of people coming into the system at this time? And also, I also wanted to find out if there's been any communication between the government of Trinidad and Tobago and American Airlines. I know that there was articles stating that they wanted a confirmed date as to when they might be able to resume operations in Trinidad.
Thank you. CMO?
Right. So in terms of your initial question, we don't expect that 103 out of those, well, all of the 103 will be positive. That is highly unlikely. However, the parallel system does have enough space to cater for that clinical load. Our clinical capacity is much greater than that. In Cora alone, we have 100 spaces allocated, and they're about just above under 200 spaces in the Cuba facility. So there is enough space in that facility. You want to answer the American?
Yeah, on the question of American Airlines, that will not be a question that could be answered from the Ministry of Health. That will be for other parties to determine.
91.9.
Yes, hello, good morning, everyone. To the next of all, 91.9 FM. Minister, I just want to track back a little bit to the conversation on Saturday. I know my service wasn't too great. What I had gotten was some information from the Nursing Council, from its president, that nurses had to wear PPE for 12-hour periods at a time. And because they had to wear the PPE for that length of time, they were subject to getting the infections that we spoke about. So it leads me to ask today, if we could get some feedback on the status of the PPE that we do have, and if there is any guidelines from WHO or any other governing body that could let us know exactly how these PPE should be worn. Is 12 hours too long? And, you know, whether that is good practice, bad practice, or whether we just in a situation where we can't get access to enough PPE not to have that. And if I'm allowed, the second question is really relating to our threshold for how many people can we accommodate when it comes to quarantining. What is going to be that cutoff? Are we going to say, all right, once we reach 600 persons in quarantine, we'll have to hold up on letting persons in? Can you speak to that?
Okay,
if you
so
can, that'll be appreciated. Thanks.
Okay, so I will take a couple of them, and the CMO will take the technical part. There has always been this narrative, unfortunately, that Trinidad and Tobago does not have enough PPE. That is absolutely false. We even brought Nurse Gomez here to speak to the issue. There was even an interview with a nurse on one of the newspapers about a month and a half ago, representing the view that there was absolutely no problem with PPE. And she also indicated that her cousin, who is a nurse in a developed country, wished that they had access to PPE like we have. I have been at pains to secure PPE for all healthcare workers. I have been at pains to explain to the public in the early days that PPE is given out based on the level of exposure and risk. So how we give out an N95 mask to a particular type or category of healthcare worker will be different. We even had Dr. Marlon Rampal here, who is an infection control specialist, explain to the media and to the public how PPE is used and what categories of staff get the different type of PPE. There has never been any shortage of any PPE for any healthcare worker in Trinidad and Tobago. And I'll turn you over now to the CMO to talk to the technical issues of wearing PPE.
So the question asking about a guideline, so there is a Ministry of Health guideline, which is, of course, disseminated to all the RHAs as well as all the, through the medical association to the physicians. So there's a Ministry of Health guideline that speaks to the wearing of PPE. It speaks to the types, how long you should wear it for, how you should don it, how you should doff it. Donning is putting it on, doffing is taking it off, which over the years, having infectious diseases, a lot of people would have contracted them while they were doing the process of taking them off in the healthcare setting. So there are specific guidelines as to how to remove different types of PPE. So we do have a guideline that is disseminated to all our stakeholders.
I think there was another question concerning something about accommodation.
Accommodation, okay.
I think he was basically asking what is the cutoff for our intake in terms of...
Yeah, so the cutoff for intake, we don't have a date in mind. The cutoff for intake is predicated on your capacity.
Number.
Yeah, the number. So the parallel healthcare system before the cruise ship accommodation and before UE was about 922, roughly. Of that, about 400 and between 400 to 500 was dedicated to hospital care, where you put COVID positive patients. The other part was dedicated to convalescence, quarantine, step down. I would have indicated several times again that just because you have 500 beds, so to speak, in normal circumstances in a hospital setting, when you start to approach an occupancy rate of around 80, 85, 90%, you are considered filled. You don't want to go beyond that. For infectious diseases, we bring that down to about 75%. So if we have 400 beds for convalescence, quarantine, and so on, you take that down to about 75%, which brings you down to about 306. So bringing in more people, we have to wait until we turn over those facilities to bring in more people. That is why the calls of some persons in some quarters to open the borders is such an uninformed, uneducated call, and quite frankly, dangerous to the health of Trinidad and Tobago.
Thank you. Astronaut Health.
Astronaut Health News, Gwyneth Stewart. Good morning, everyone.
Good morning.
My questions are on behalf of concerned citizens. Is the number of persons allowed to attend a funeral service dependent on the accommodation capacity of the church, inclusive of physical distancing, or is the number restricted to 10? And the other question, what is being done about persons who have not received the COVID-19 social relief grant for loss of income and for school-aged children? One person from Chaguanas was told by the Chaguanas Borough Corporation that cards have finished and he will get a hamper or a voucher.
Okay,
Could
so
I get some
I'll take the first question and Minister Cox will most likely take the second one. So yes, the number of persons permitted to attend funerals is 10, and that will stay so until we make a further announcement. So it's 10 at this point in time. Thank you very much for allowing me to clarify.
Okay, concerning the is it the salary relief grant you're talking about? They are still giving out salary relief grant, so ask the persons to hold strain, please, concerning the salary relief grant. With regards to the food cards, I'm aware that 500 food cards were distributed to all members of Parliament, and after that is finished, there was also a provision for foodstuff
packages
and market produce and so on. I know that that was also afforded, given to members of parliament. Even the regional corporations and so on have also been given allocations. Churches were also given grants to assist with foodstuff. Okay, so ask the persons to check. But concerning the salary relief grant, they are still giving out salary relief grants. CLC.
Hi, good morning. Yulan Thomas from Caribbean Lifestyle Communications.
Morning.
Can you give us an update as to the persons who should be coming in today, if or not?
Coming in to do what?
Who should be? We didn't hear you clearly, Yulan.
Persons who should be coming in today as it relates to be quarantined, like anything. I know that they gave a listing of persons who should be coming in.
I think you learned that has to do with the UE students from either Jamaica or Barbados. I think some came in, and I have that information here. I'll get it for you. And so just ask, let's go to another question, and I'll get it for you here. Okay? All right.
So we'll go to Express, and we'll come back to answer your question, Yulan. Express.
Good morning.
Good morning.
Good morning. Am I being heard?
Yes, we are hearing you. Good morning.
Yes. Good morning. Good morning, ministers and CMO. Minister Dale Singh, I know that a lot of the questions going forward now are very speculative because this is a really unprecedented and unpredictable situation. And so I think what I want to ask is, we are at capacity. Of course, we've had some more positive cases. It was expected. The CMO just did mention that where you get a large group of people, it's not expected that they would all be positive. And people are clamoring to come home. So I think what people are asking now, because they are beginning to feel a sort of an extreme pain that they may not make it home till next year, that there are people who simply left for whatever reason and now they may not come home till a year later. And so the question is being asked, given the funding, given the context of what's happening in the world, is it not possible for us to expand our quarantine facilities, at least maybe where we could double that capacity, and no other way for us to expand our healthcare facilities? Maybe the CMO can answer that. Okay. Because people are saying, don't we have a lot of medical personnel that we can take on? Don't we have a lot of buildings, for instance, that we could begin to convert into serious quarantine or maybe even treatment facilities? We know funding going forward is something that has to be watched. I think that's
the question.
That's what I'm asking.
Okay. So Kim, I want to thank you for the question. In 1 week, we negotiated with a cruise line and we went to UE and we expanded and we found an additional 500 plus accommodations, 200 plus at UE and 300 plus aboard a cruise ship. So in one fell swoop, we literally doubled by 100% our quarantine facility. So we have in fact done it. As far as HR is concerned, since the start of this pandemic, we at the ministry have employed an extra 546 health professionals, the majority of which are nurses, some are doctors. So 546 persons who previously did not have a job now have a job. So we have expended millions of dollars in employment, 546. In 1 week, we doubled the capacity of quarantine facilities. And we will continue to do our very best to bring in persons in a measured, strategic manner, marrying humanitarian concerns, but also the concerns of preserving life in Trinidad and Tobago. Because if we become reckless, my initial opening comments were, if we remember, so far we have not had to roll back any of the business openings. That's our consideration. Other people would not consider that. But could you imagine if we just allowed people to come in, have them quarantined in less than ideal conditions, you get widespread community activity, and then you have to go back to where you were 2 months ago. Trinidad and Tobago is in a unique position, being recognized globally as a leader in how to reopen an economy. And it's balancing the rights and responsibilities of a lot of stakeholders with competing interests. What the government is doing, led by the Honorable Prime Minister, is walking a very fine line. And so far, we are recognized as a world leader. As I said in my opening statements, now is not the time to reverse that by making rash decisions. So we have expanded, we have doubled, we have employed an additional 546 people, and we have done marvelously well so far. Thank you very much, Kim.
Thank you. CNC3.
Good morning, ministers and Dr. Paris Ram. So before these cruise ship crew members were allowed back into the country, right, many of them would have told the media about the anxiety and other mental problems they would have been facing because of being in isolation. Is any consideration being given to provide some sort of mental support for these crew members while they are in quarantine?
Yeah, so the medical support that we provide through the county medical officers of health all include at all the facilities the possibility of mental health, which is done through the office of the Director of Mental Health, which is Dr. Otello. So there's coordination between the CMOH and Dr. Otello. If on their daily checks they flag any mental health issues, that is sent to Dr. Otello's unit, and through the regional health authorities as well as her own unit, they dispatch some assistance. Sometimes it's done virtually, sometimes it may have to be in person if need be, but that has been done throughout the quarantine process.
Thank you. Minister, are you ready with, there was an answer? Did you get the information?
Yes, well, I had to answer Kim's question. You found out on CMO?
So in terms of...
Yeah. So we have the answer here. CMO is trying to get his notes here. Yes, we have it.
Barbados.
Yeah. So the Barbados contingent CMO, 85. Will be coming in. They will be in the UB halls. We have 17 persons from another cruise line. They will go to Debe. Yeah. We have 5 from Disney Wonder. They will go to Debe. We have 49, which I am told, these are people from Mexico. They will be going to K-Pop, but I think their company is paying for their quarantine.
Yes.
Right?
Yes, that is today.
I think that is sometime soon. And then we have another 2 groups. I can't give you a firm date. They are pending. Okay?
Okay.
So that's the information we have for you right now.
Thank you very much. I just want to go back to ACP News. Prior, one question, please.
Hi, good morning again. I just wanted to get an idea of the exact number of people who are on board the enchantment of the seas, because on Saturday, Dr. Richard said that 306 people were processed, and in a release yesterday from the ministry, they said 308 samples were taken. Can you just give me an idea if 1 or 2 more persons came on board? I just wanted to get the exact number.
I don't have the exact number of persons on board, but there, if you remember right, there were some crew members outside of Trinidad Nationals that would have to see to the needs of those individuals, which those persons won't be coming off the vessel at all to come into Trinidad. They are non-nationals, so they include doctors and nurses as well, if I remember right. I can get the actual number of persons outside of the nationals to you all at a later date. All right.
Also prior, as I did indicate, speaking to the media both last night and this morning, 1 person's test had to be redone.
Correct.
So that will account for 1 person having 2 tests because 1 test was spoiled. So 1 person would have been redone. So of the original 306, you have 6 persons now in Cora. So you should have theoretically 300 members on board, plus whatever staff on the ship. Okay?
Okay, thank you. We move to TV6. One question, please.
Thank you. I wanted to ask about the hotels, the use of hotels. We see that several hotels are being used using paper, custodial transfer. Just wanted to find out from you, Minister, how are they being selected, who's doing there, and
how are they being selected? Okay, how they being selected? Sorry. So, thank you. So they are being selected based on the exemptions granted by the Minister of National Security after he speaks to both myself and the Chief Medical Officer.
How are the hotels being?
Oh, how the hotels being selected?
Concerning K-Pox,
so the permanent secretary would have gone off to the tourism industry, the hotels industry, with a RFP, and they would have responded. So that was the method by which they were selected.
And if you want me to add. So in terms of, so the RFP would have been done through the PS's office. And of course, there was a technical team. We have a checklist that we would require for any quarantine facility. So all the hotels that actually said they were interested, they were assessed both physically by visitation, as well as a checklist that we have to ensure that they meet the quarantine requirements. All right.
But in the K-Pox setting, the company is paying for those 49 individuals, not the state. Okay?
98.1. One question, please.
Good morning again. Thank you for the opportunity. Stephen Cummings, 98.1 FM. Minister Dayal Singh, just a quick question. We are obviously into, the political season, and I'm wondering how concerned are you with comments and statements that we've been seeing on social media. Many of those comments hit at the management of the healthcare system and health workers. How concerned are you in terms of these comments, as I said, on social media and otherwise, impacting on derailing some of the gains that the ministry has had with respect to treating with COVID-19?
Well, Mr. Cummins, I don't know what the comments you are, so it's difficult to me just to respond to comments, and I don't know what the comments are on social media.
Well, we are at capacity, and not enough is being done to properly manage our workload.
Okay.
Right. I really don't want to repeat some of those, but
that's all right.
There have been comments that
okay, I understand. So let me let me say it again. Our hospital, parallel healthcare system, parallel two lines, two pathways. Our normal hospital system was never touched by COVID. Everything went on as normal. People had their children, births, operations went on as normal. The only part of the traditional healthcare system that was affected was elective surgery, which we started back about 3 weeks ago. We are 80% there. And how you manage outpatient clinics. So you will see tents outside the hospitals and so on. So that part of the healthcare system was virtually never touched. There is no idea or no talk about overcapacity there, absolutely none. The other part of the healthcare system is the part that dealt with COVID. We could take that line and split it into two. Treatment at Cora and Couva, where you have over 300 spaces. To date, they are only being occupied by 6 persons, 6 out of 300. So there's absolutely no risk, even if we get another 100 people turning positive, of an overwhelming of either Cora or Couva. That's why we built overcapacity. And then we also have Augustus Long as a backup with another 50 to 60. So there is absolutely no talk, and that is why social media is so dangerous. The quarantine facilities now, we have about 400 spaces for quarantine. At any one time, we don't like to use more than 75% of those facilities. It is those facilities that we are speaking about, quarantine, where you are bringing back people, that we don't want to overwhelm. And that is why we can't simply open the borders. In the past week, we have doubled that capacity by using the cruise ship and by getting an extra 200 spaces at UWI to accommodate the returning students. So in one fell swoop, the quarantine part of the parallel medical system grew from 400 by an additional 600. So that part grew by 1,000. That's a phenomenal achievement. So I would advise you, Mr. Cummins, yes, read social media, but totally ignore it.
Thank you.
Thank you very much.
Express, one question, please.
Hello, thank you again. Good morning again, Kim Woodram from Express. Minister or CMO, just for clarity, for those who are not sure and have gone back out to work, they are commuting, may we go ahead and visit our parents, our grandparents, and other seniors in our lives? I think some people are just not clear on that. And are we to assume, of course, that we continue to observe the protocol when we choose to visit vulnerable people?
Okay, CMO.
Thanks.
That's a reasonable question.
So I mean, there's no one size fits all for the answer. Of course, if you're ill, you shouldn't do it. So, I mean, basically, use your normal precautions, but visitation has to be a personal choice based on how you feel. If you are well, of course, if you're unwell, you don't. And then when you go to visit, the level of interaction has to be based on personal choice again. But I mean, given what we are seeing and we are allowing this level of freedom in society, we expect that there will be more frequent interaction with persons. We still stand by our regulations as it speaks to large congregations. For example, in homes for the aged, those regulations still stand in terms of prohibition of visitation. But for individuals, I think we can have a little more freedom than before.
Thank you. Newsday, one question, please.
Hi, morning again, everyone. This is a question. I don't know who may be able to answer this one. I was just trying to get an update with respect to the report to the Attorney General with respect to the Brooklyn Settlement Facility in Sangre Grande. I don't know if anyone can assist with that.
The Attorney General did speak publicly about this. It was carried in one of the newspapers. He said he has found nothing untoward about it. As soon as I get back his written advice, I will just take it to Cabinet for their information. And if we have to make it public, I will have absolutely no problem in making it public. Thank you.
Okay. TV6, one question.
Just a quick question. Just a follow-up on the hotels as well. Is there any consideration to use more hotel stock for private citizens to retain if they are willing to?
She froze up.
Okay, repeat your question.
Oh, I just wanted to know if there was any consideration to use more hotel stock at quarantine facilities for private citizens who could pay their way back to clinic.
Yeah, so that is a decision that will be made by Minister Young, myself, and we'll talk about it, but we don't have a firm position on that as yet. I just want to clarify something that Mr. Cummins raised. In every single press release we send out, we always say, please ignore misinformation on social media. Please. And I want to give you an example. The issue of that so-called tent gate at Eric Williams last week. Do you see how much anxiety that social media cost this country? For a half day, the CEO of Northwest and myself, there was a picture of me with a mask saying I'm a bandit minister. And we had to spend a half day taking away my time and the CEO's time of running the health system to respond to a social media post to which a person has now apologized. That is the danger of social media, and it is driving a national conversation. So it's not that I'm against social media, I'm against posts which have the calculated objective of sowing disharmony and discord in the society. An apology is not good enough at this point in time from that individual. And that is not the first time he has posted stuff about North Central RHA. And in talking to the CEO, we are going strongly on the legal route, because what he did, forget the reputational damage to myself and the CEO. We had to stop what we were doing for a half day to respond to the media, to debunk the theories that what was posted was a quotation. It was not a bill. It was not a contract. And that is the danger of social media. Okay? Thank you very much.
Thank you. On that note, we are out of time. And we have come to the end of today's virtual media conference. Do remember that the Ministry of Health and the Ministry of Communications are your only credible sources of government information on COVID-19. Trinidad and Tobago, I would like to appeal to you to remain vigilant and follow the public health guidelines. It is easy to get complacent, but COVID-19 remains a real threat, and to date, there is no cure for the virus. We know that 6 persons from the cruise ship Enchantment of the Seas have tested positive, and they are at Cora Hospital for treatment, and all other cruise ship crew members remain quarantined on the vessel. As such, there is no risk of local transmission to Trinidad and Tobago. But it is a reminder that COVID-19 is still at our doorsteps, and this means we must be disciplined and continue to keep our distance from each other. Wash our hands, clean, then sanitize our surfaces. Wear a mask over our noses and mouths. When out in public, cover our coughs and avoid touching our faces. These measures go a long way to keep us safe as we adapt to the new normal. I am appealing to you, please let us not become complacent. We know many of you are asking about the next phase of the reopening of our country, and we understand that you are anxious to know when you can return to your favorite bar or even enjoy a movie at the cinema. And we will get the answers to those questions on Saturday, June the 20th, when the Prime Minister, Dr. the Honorable Keith Rowley, will provide information on the next phase, based on the advice of our public health officials. Let us be patient and hear what he has to say. But do remember, our behavior also influences the decision-making. And remember, we are all in this together. I am Donna Cox, Minister of Communications. Thank you for joining us today as the government continues its efforts to keep the curve flat and beat COVID-19. Stay safe. May God bless Trinidad and Tobago.